Do you suffer from severe low back pain, spinal stenosis, sciatica, leg pain, maybe all of the above? Well, if so, Dr. Keith Currie wants to send you a free report that you're going to find helpful. It's a $19.95 value. Yours free just for making a phone call. Call that number on your screen right now to get your free copy of his life-changing report. You know, Dr. Currie is internationally known for his unique treatment protocols, and that's great. I'm proud to work with a doctor with his great skills, but you know, when all is said and done, all that matters is results, and that's what people get when they trust their aches and pains to Dr. Currie over and over and over again. The man himself is right here with us. Greg's here, and we're going to be talking to Greg in just a minute. But Dr. Currie, through the last 13 years or so, you have brought patient after patient into the studio to tell about their miraculous improvement after having failed neck and back surgeries and horrible sciatica and things like that. How does that make you feel to see all these people just walking around and enjoying life?
Dave, the days in the studio with you and my special guests, my patients that I love and care about, are some of my favorite days because it's wonderful getting to hear how, you changed people's lives. And I mean, we got to be real. These treatments not only change lives, they save lives. I've had people tell me that they don't think they'd be alive today if they were still suffering the way they were when they first came in.
Well, we have another example of that in our studio with us today. This guy's name is Greg, and Greg, I mean, like so many of your patients, Dr. Currie, Greg was suffering greatly. Tell us about what happened to you, Greg.
I haven't been good to my body over the years, and I didn't know really how bad I had not been to my body. And after I retired, I was landscaping on the property and building some rock walls, and just hit me, and I went down and couldn't get back up. And after visiting the doctors, getting an MRI, I had very bad sciatica and scoliosis in the L5 through L1, and the doctor referred to it, the neurologist referred to it as a hot mess. And so I tried the epidurals. I did not want to have surgery. I was beating the weeds trying to find some alternative to surgery, and I saw this infomercial from Dr. Currie, and he was right down the street, if you will, there in Conway. I said, I'm going to give him a try. And, I don't like to use cliches, but he changed my life. He gave me my life back, and now I'm looking forward to retirement and the rest of my life rather than dreading it.
We kind of like that cliche, don't we, Doc?
Yes, sir. Yes, sir.
Changed my life. How did you treat him? First of all, give me how you arrived at a diagnosis and then a treatment schedule.
Well, Greg, we've talked a lot about it. He has a horrible case of scoliosis. He's got degenerative disc disease and arthritis, spinal stenosis. Those nerves were getting choked and pinched and pressured. And, surgically, what surgeons will do is they'll go in and clean the area up or maybe trim off the part of the disc that's pinching the nerve. What I do in my clinic is different because it's all natural and non-invasive. And we use deep tissue lasers to reduce the inflammation inside and take the pressure off of the nerves. And then we work with the discs themselves to hydrate them, to pull fluid into that disc to create more space.
You need to go talk to him, and maybe I have a unique skill set because I have a degree in biology, I have a degree in chemistry, and sitting with Dr. Currie, we were 90 minutes for the original consult, and we were mashing molecules up on the board, and I knew right away that this is what I wanted, and I wanted to try it. And other folks may not understand that depth of the chemistry or the biology, if you will, but I believe that he puts it on a scale where you can understand, the layman can understand it and appreciate it. It may not be for everybody, but for me personally, it was a life changer for me personally.
That's great news, great news. Congratulations to you. And folks, if you're having some of these symptoms that Greg has had, don't forget to get on the phone. I would suggest you do it right now. Call the number that's on your screen right now. Get that free report that Dr. Currie's making available to you. It's a $19.95 value. You can get it for absolutely free. And you, too, one of these days could say, that changed my life.